5 health checkups you should avoid after 70 that may harm you more than help. Once you turn 70, it feels like every doctor visit comes with another routine test. But here's the shocking truth. Some of these checkups may actually harm you more than they help. Every year, millions of Americans over 70 line up for medical tests believing they're protecting themselves. But what if I told you that some of these so-called essential checkups could push you closer to surgery, stroke, or even cancer? New research reveals that up to 37% of medical tests in older adults lead to unnecessary treatments, serious complications, or lifelong side effects. And here's the part no one talks about: nearly every senior over 70 has no idea they're being over-tested. One of the checkups on this list, our number one offender, is linked to 5% of all cancer cases in the U.S. That's the same risk as drinking alcohol every single day. You won't hear this from your clinic. You won't see it on a billboard. But the science is out there, and today, we're uncovering the 5 checkups you should avoid after 70 and the disturbing truths your doctor might not be telling you. And wait until you see what made it to number 2. It's shocking. Before we dive in, drop a comment below. Where are you watching from? How old are you? Have you ever regretted a medical test or procedure? We're reading and responding to every single comment with personalized tips. And don't forget to like this video and subscribe so you never miss important health updates that could protect you and your loved ones. Number 5, bone density scan, a test that can do more harm than good. Here's a seemingly harmless test, a bone density scan, also known as a DEXA scan. It's quick, painless, and often touted as an easy way to see how healthy your bones are. Sounds like a smart move, right? But here's what most people over 70 don't know. This test often causes more fear and more harm than it actually does. DEXA scans measure bone density to detect osteoporosis, but in older people, especially women, the results almost always show some degree of bone loss. And the problem is, in many cases, it doesn't actually mean you're at risk for a dangerous fracture. Bone loss is part of the natural aging process, just like gray hair or wrinkles. But these results often prompt patients to seek aggressive treatments. Doctors often prescribe bisphosphonates, powerful drugs designed to strengthen bones, even for people with only mild bone loss. The problem: these drugs come with serious risks, damage to the esophagus, serious digestive problems, and in rare but dangerous cases, necrosis of the jaw, a condition in which part of your jawbone actually begins to die. And here's the worrying thing: the benefits are tiny. Research shows that in adults over 70, these drugs reduce the risk of fractures by less than 1% over 5 years. That's not much. Take Helen, a 70-year-old grandmother who came to our clinic. She had no history of falls, was very active with her grandchildren, and had never had bone pain. After a routine DEXA scan, she was diagnosed with osteoporosis, mild bone loss, and was prescribed medication right away. Within months, she had persistent acid reflux, nausea, and severe jaw pain that made eating difficult. When she came to us, we tried a different approach: strength training, balance training, vitamin D supplements, and a calcium-rich diet. Within a year, Helen's bone strength had improved naturally. Her pain was gone, and she felt confident and fearless. The point is, for many people over 70 who don't break bones or fall often, lifestyle changes are much safer and more effective than prescription X-rays. In fact, studies show that exercise, nutrition, and vitamin D can reduce the risk of fractures by more than 20%, much more effective than medication. So before you let an X-ray decide your future, ask yourself, do I really need this test? Or am I about to embark on a treatment that could do more harm than good? And if you find this worrying, wait until you see the 4th result, a routine checkup that could lead straight to the operating room. Number 4, brain MRI for memory loss, the scan that can create more fear than answers. If you're losing your keys more often, or struggling to recall names, your first thought might be, am I developing dementia? Doctors often respond to that fear by ordering an MRI, a detailed scan that shows the brain's structure. It feels like you're finally taking control of your health. But here's the uncomfortable truth. Most brain MRIs in people over 70 don't provide the answers patients hope for. In fact, they usually reveal something completely normal for aging's slight brain shrinkage. Tiny white matter spots findings that look alarming on a report, but mean nothing dangerous. And here's where it gets worse once those spots are found. They can set off a chain reaction of panic, extra tests, and even invasive procedures, all for something that won't improve your memory. Some patients are even pushed toward unnecessary brain surgeries or spinal taps based solely on vague MRI findings. A large 2021 study in Neurology Today reviewed over 3,000 brain MRIs in adults aged 65 to 85 with mild memory complaints. The results, 86%, showed some kind of abnormality, but only 3% were linked to an actual treatable condition. That means nearly everyone went through the emotional pain of being told their brain looked abnormal when, in reality, it was just aging. Even worse, 12% ended up undergoing invasive procedures like spinal taps or exploratory biopsies, all triggered by a scan that rarely changed their care plan. Take Frank, a 72-year-old retired high school principal. He came to us worried because he kept forgetting appointments and sometimes blanked on people's names. His doctor ordered a brain MRI, which showed white matter changes. Terrified, he convinced himself he had early dementia. He stopped driving, avoided social gatherings, and his anxiety grew by the day. But when we assessed him with a standard cognitive screening test, a simple, paper-based tool, his score was perfectly normal for his age. We explained that his MRI findings were just part of aging, not a disease. Instead of focusing on the scan, we shifted his attention to what actually helps improving sleep, staying hydrated, doing brain-stimulating activities, and connecting socially. Within 3 months, his confidence returned, his memory improved, and he was back to his weekly coffee meetups with old friends. The reality is this: unless you're showing severe neurological symptoms, seizures, sudden personality changes, or rapid decline, a brain MRI is rarely helpful for mild forgetfulness. A far better first step is a cognitive screening test. It's quick, inexpensive, and avoids the spiral of fear that a complex scan can trigger. And if you think this test was overused, just wait until you hear number 3, a checkup you've probably had more than once, and it's far riskier than most people realize. Number 3, cardiac stress test. When checking your heart becomes dangerous. If you're feeling a bit more tired than usual, experiencing mild chest tightness, or simply not moving like you used to, your doctor might order this test. It involves walking on a treadmill or receiving medication that simulates exercise while your heart is monitored. The goal: to spot blocked arteries before they cause trouble. It sounds reassuring, but here's the uncomfortable truth for many people over 70, especially those without clear signs of heart disease. This test often creates more problems than it solves. Why? Because the accuracy drops dramatically with age. Studies show that in adults over 70, the false positive rate for stress tests, meaning the scan suggests a blockage, when there isn't one, can be as high as 40%. And what happens after a false alarm? A cascade of unnecessary promiscuity invasive procedures. Follow-up tests like angiograms and even stent placements or bypass surgeries are often performed based on those questionable results. In fact, a major 2017 study published in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms and saw no improvement in survival or quality of life. But they did experience something else: higher rates of bleeding, kidney injury from contrast dyes, and long hospital stays. Take Lillian, a 73-year-old retired teacher who came to us last year. She was active, loved gardening, and mentioned feeling slightly winded while climbing stairs. Her doctor ordered a stress test just to be safe. The results were inconclusive, which led to a catheterization, a procedure where a tube is inserted into the arteries to check for blockages. They found a mild narrowing and placed a stent. But that night, Lillian developed a severe reaction to the contrast dye, suffered kidney damage, and spent a week in the hospital. Months of follow-up care followed. And the worst part, her shortness of breath didn't improve because it wasn't her heart at all. She was simply deconditioned from a long winter without exercise. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, shortness of breath with exertion, or sudden drops in energy during light exercise, a stress test might do more harm than good. A better first step: a resting EKG, which simply measures the heart's rhythm while you're at rest, or even a coronary calcium scan, a low radiation imaging test that shows if dangerous plaque is actually building up. These options are safer, simpler, and far less likely to push you into a hospital bed you never needed to be in. And if you think this is risky, wait until you hear number 2, a test so common it feels routine, but it comes with a hidden cost that will shock you. Number 2, colonoscopy, when routine screening becomes a dangerous gamble. It's long been considered the gold standard for detecting colon cancer, but here's the reality: after 70, and especially after 75, the risks often outweigh the benefits, unless there are clear warning signs. The preparation itself is grueling. It involves powerful laxatives that can lead to dehydration, dizziness, and even kidney problems in older adults. Then comes the sedation, which may sound harmless but actually increases the risk of delirium, confusion, and long-term cognitive decline in seniors. And the procedure isn't risk-free. Complications like bleeding, tearing of the colon wall, or heart rhythm problems during sedation are all well documented. A massive 2019 study in JAMA Internal Medicine tracked over 1.3 million Medicare patients aged 70 and older. The findings: for every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved, but more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, many are small, slow-growing, and unlikely to ever cause harm. Removing them in a frail patient can sometimes cause more damage than simply monitoring them. Take Mr. Alvarez, a 74-year-old retired carpenter who came to us after a nightmare experience. He had no bleeding, no changes in his stool, and no family history of colon cancer. But at his annual checkup, his new doctor insisted on a just-to-be-safe colonoscopy. During the procedure, they removed a small polyp. That same night, he developed severe abdominal pain and collapsed at home. He was rushed to the hospital, where they discovered a perforation in his bowel. He spent 11 days in recovery, lost significant weight, and months later still struggled with weakness and digestive issues. When we reviewed his history, we found that he had already had 2 clean colonoscopies before age 70. There was no reason to repeat it. That's why the U.S. Preventive Services Task Force now recommends stopping routine colon cancer screening at age 75 for most people. And for those who are healthy and want continued screening, non-invasive options like the FIT stool test are safer. They can be done at home, require no sedation, and still catch most concerning cases. Before you schedule a colonoscopy, ask your doctor if you really need it, or if there's a safer way to protect yourself. Because once you step into the colonoscopy pipeline, it's easy to get caught in a cycle of procedures you may not need. And now we've reached the most overused, most dangerous, and most harmful checkup for older adults, one you've almost certainly had before. Number 1, annual full-body CT scans, the most dangerous checkup seniors are sold. And now, number 1, the most overused and most dangerous preventive test pushed on older adults, the annual full-body CT scan. You've seen the ads. It's marketed in fancy clinics and executive health packages as the ultimate way to catch problems early. On the surface, it sounds like peace of mind. Who wouldn't want to find cancer or heart disease before it starts? But here's the truth that almost no one tells you. For people over 70, these scans rarely help and often cause real, lasting harm. Let's talk about why. First, radiation. A single full-body CT scan delivers 10 to 20 millisieverts of radiation, roughly the same as 500 chest x-rays. And people don't just get one. These packages often encourage you to repeat them every year. That's a staggering amount of exposure. According to a 2023 modeling study published in JAMA Internal Medicine, the increase in CT scans across the U.S. may now be responsible for up to 5% of all cancers nationwide. That puts CT scans on par with alcohol as a cancer-causing factor. Think about that one, and every 20 cancers may actually be caused by the very scan that was supposed to protect you. And the irony doesn't stop there. These scans often find things that were never going to hurt you. Tiny harmless nodules in your lungs, calcifications in your arteries, cysts in your kidneys. All of these can be completely normal signs of aging, like gray hair on the inside. But the moment they appear on a report, a red flag goes up. You're sent for more scans, more biopsies, sometimes even surgery. Suddenly, what started as a checkup for peace of mind turns into months of anxiety, invasive procedures, hospital stays, and real health complications. Take Eleanor, a 77-year-old retired dance instructor who felt great. She joined an elite preventive health program at a private clinic and agreed to a full-body scan. The scan found a tiny 4-millimeter spot on her lung, so small that most doctors wouldn't even call it dangerous. But she was referred to an oncologist, scheduled for a PET scan, and ultimately underwent a needle biopsy. The biopsy punctured her lung, causing it to collapse. She spent 2 weeks in the hospital and needed months of recovery, and the result of all that benign. It wasn't cancer. It wasn't dangerous. It never needed to be touched. Stories like Eleanor's are far too common, and they expose the real issue. Full-body CT scans for screening don't extend life, don't prevent disease, and don't improve your health. What they do is expose you to radiation, fear, and a cascade of risky follow-up procedures. That's why the American College of Radiology and other medical experts strongly advise against using full-body scans for routine screening in people without symptoms. So what should you do instead? Listen to your body. If you're experiencing concerning symptoms like unexplained weight loss, persistent cough, coughing up blood, or sudden swelling, targeted imaging can be life-saving. But scanning your entire body when you feel fine, it's like digging for treasure with a landmine detector. You might find something, but you're far more likely to get hurt. Your health, your time, and your peace of mind are too valuable to gamble on unnecessary, fear-driven screenings. The smartest thing you can do: stick with regular checkups, talk openly with your primary doctor, and focus on tests that are truly needed. Because real prevention isn't about scanning everything. It's about making informed, thoughtful choices that protect your well-being. So, there you have it. 5 common checkups that might look helpful on the surface, but can actually do more harm than good, especially once you're past 70. Modern medicine can save lives, but it's not perfect. In fact, sometimes the most powerful thing you can do for your health is to pause and ask questions. Before you agree to any scan or procedure, always ask yourself what happens next. If this test finds something, what will it lead to? More scans, surgery, medications with lifelong side effects? And most importantly, will it actually improve my quality of life, or just make me more afraid? Because real prevention isn't about chasing every possible test. It's about making thoughtful, informed choices that truly protect you. Staying active, eating real, nourishing foods, getting good sleep, managing stress, and having open conversations with a trusted doctor are far more powerful than most screenings will ever be. Now, we want to hear from you. Have you or someone you love ever gone through a medical test or treatment that turned out to be unnecessary or even harmful? What happened? Share your experiences in the comments. Your story might help someone else make a smarter choice. And if you found this video helpful, give it a like, subscribe for more health insights, and share it with someone you care about. Thanks for watching, and remember, your health decisions matter more than any test ever will. And here's something we don't talk about enough. It's not just the tests themselves. Far too often, these unnecessary scans and checkups lead to unnecessary treatments. And one of the biggest culprits, medications. Think about it. A test shows something borderline. A scan picks up a tiny change, and suddenly you're leaving your doctor's office with a new prescription or 2 or 3. It feels like the safest move at the time. But here's the harsh truth. Many of these medications don't actually improve your health or extend your life, and some come with side effects that can quietly rob you of your independence, your energy, and your quality of life. Take a look at the numbers. Studies estimate that nearly 40% of adults over 65 are taking at least 5 prescription drugs at the same time. This polypharmacy, as doctors call it, doesn't just increase the risk of dangerous interactions, it also raises the risk of falls, hospitalizations, and cognitive decline. And here's the part that will shock you. Some of the most commonly prescribed medications for older adults are now considered unnecessary for the majority of people who take them. We're talking about drugs like proton pump inhibitors, PPIs for heartburn, which can weaken bones and increase the risk of infection when used long-term, sedatives and sleep medications, which may seem harmless, but can raise your fall risk and worsen memory, and certain cholesterol or blood pressure drugs, which, when given to otherwise healthy seniors, may cause more side effects than benefits. But the real danger isn't just the drugs themselves, it's the cycle they create. One new medication causes fatigue, so you get another to boost your energy. That drug gives you stomach pain, so you're prescribed something for your digestion. Before you know it, you're juggling a bag full of pills, each meant to fix the side effects of the last. And no one stops to ask, do you even need the first one? This is why it's so important to step back and ask the same questions we asked about those checkups. What happens next? What's the actual benefit? What are the risks? Sometimes, the best thing you can do for your health isn't adding another pill. It's taking one away. So in our next video, we're diving deep into this issue. We'll reveal the top 3 most overused medications for older adults drugs that millions of people take every day, often without knowing the risks, and we'll show you safer alternatives that could give you back your energy, your clarity, and your peace of mind. If you thought these checkups were eye-opening, wait until you see what we've uncovered about the medications hiding in your own medicine cabinet. Click on the next video, you won't want to miss this.